I'm a registered nurse. I have been at Children's. Next month. It'll be 4 years since I worked as a monitor tech and patient care assistant for 2 years before I became a nurse. I always knew I wanted to do something in the medical field, but it took me a couple years to figure out that nursing was the path that I wanted to take. Throughout nursing school, I was a monitor tech and a PCA in the NICU to begin with. Working there while in nursing school, in between that and the clinical experiences I had, I really looked up to the nurses that were able to be voices for patients and patient populations that maybe couldn't advocate for themselves. I thought that was a really cool aspect of being able to work in the NICU. I also really liked that there's just so many different things that you could see and do. That kind of drew me to it as well. I rotate back and forth between night shifts and day shifts. I had this patient 3 nights in a row. You get a history on your patient when you come in, and you could tell that they had just been through so much already in such a short amount of time. It was pretty clear that they were going to have a pretty long road ahead of them as well. It's hard to explain sometimes, like when you have patients and you just kind of feel like a bond, or you just connect with them in a weird way. I just really felt like she's been through so much. She has such a long road ahead. I'm going to join her care team, and I think she can really benefit from having another nurse that just has her like every day pretty much, that I would go into work and could really know her. It really helps with seeing the clinical picture too. Is this something they usually do? Is this something that's new for them? Kids that are there for a long time, I feel like can really benefit from having consistent care teams and nurses that are able to know them. When I went back to days and I started to interact with family more and seeing them pretty much every day that I'm working and they're there every day, you build that trust over time and you build that bond. When she was having these big moments in her journey or something new was coming along, I think it is comforting for families to have a nurse that they know knows their baby and they feel comfortable asking you questions. I think that does help relieve some anxieties and give them someone to just have an outlet to talk through different things with. If I don't know the answer, I can go find someone that does know the answer and all that good stuff. A big thing I learned is how impactful it is for families. They really love having that familiar face and seeing the same people, feeling comfortable, having you take care of their loved one. I learned too that you have to kind of meet families where they are in their journey. You have to come into each day and feel out where they're at that day, what they're up for, what conversations they maybe don't want to have. A lot of it, I think, comes with time and experience too. Being a newer nurse, it's definitely can be harder to feel confident in knowing that you're picking up the right cues, saying the right things, and what you're doing and saying is actually helping families feel a little bit better about situations. I think just going with your gut, coming into situations, knowing that how people may be coming across is not about you, and think about all the other things that could be going on in their lives that could be affecting them that day, and taking it slow with them. For me, I think a lot of people too, the hardest part is just seeing families go through these nightmare situations that you wouldn't ever think could happen to you. You don't ever want anyone to have to go through. I think as nurses, it's hard knowing that when there's nothing like you can do or say to really lighten the gravity of the situation. I've had a couple primaries where I joined their care team and got to see them through a good amount of their NICU stay. The parts that were always the best were seeing them meet their goals and be able to move on to the next stage of their life and go home or go to a different floor that will help them get home. The first time I read it, I just cried. It was just so touching, unexpected too. You go in every day and you do your best, and you just want to make these families feel supported and taken care of, especially when you're on their care team and you create a little bit of a deeper bond with patients and the families that are there every single day. You really care for them and you root for them and think about how they're doing, even when you're not at work. Just hearing that is just really touching. It does mean a lot, especially as a newer nurse too. You're doing your best and trying to say things that will help families and show up for them. It's very validating. They feel supported and the same way about your care as the connection you built with them as well. A big thing that I have seen and heard about is how much burnout and mental health stuff can arise, and there's just so many amazing nurses who are great bedside nurses, really love what they do. They just get to that point where mentally it's too much. Children's does have some good resources that they send information out about nursing as a whole. Not every hospital offers that or places emphasis on that, but I think that could really help the nursing world, having more experienced nurses stay at bedside longer and feel more valued and like they have a support from their hospital that they want them to stay and do the things necessary to take care of them. A lot of my friends who are nurses, it was patient load and pay when they can get paid just as much or maybe slightly less for doing something outpatient in an office where it's not as demanding mentally and physically. There are definitely some places I feel like it's those ICU environments. You learn pretty quickly whether or not mentally it takes a toll on you to the point where you can't really do it day in and day out. Those high intensity environments, it can be more mental for sure. I think it's really important, especially being a newer nurse, when it's your peers or families going out of their way to say, I see you, I see all the things that you're doing, I see that you're going out of your way to do this or this, and I appreciate that. Or families just after a hectic day just being like, thank you so much. I think that can really build a confidence in nurses. I think it can help burn out a little bit with just being all of the effort and time, mentally and physically, that I'm putting into this job is seen and it's recognized. Even though we don't do it for the recognition at the same time, it's still nice to know that people appreciate what you're doing for them.